When a client looks at you and says, I can't thank you enough, and when they really sincerely say, thank you, I can't thank you enough, and it was really only the little things, you realize that those are big things. And that's when you're proud, right? That's when you're proud that you help somebody in the smallest or biggest way. And that never gets old, right? I've been nursing for 16 years. That never gets old. My name is Gonish Keeping. I'm from Port Basques. I work at Barhaven, Port Basques, doing community health. I'm a community health nurse. I always had a want, and it sounds really cliche, just to make people feel better, right? So when I was deciding on what I was going to do, it was either nursing or hairdressing. So just want to make people feel better, you know. So I was in university my first year, just doing general studies. And I ran into somebody that I graduated with from high school. And I said, what are you doing? She said, I'm doing nursing. I said, oh. And she said, yeah. She said, I watched someone born a baby yesterday. And I was like, oh my God. And I went home, I was like, I want to do that. I want to do that. So I originally went into nursing to born babies. And lo and behold, I work in an area where we don't born babies. And from there, I just fell in love with nursing as a whole in the career. My favorite part of nursing would be end-of-life care and palliative care. So I started off with my love of wanting to see people be born, and now my love and passion are for people at their end of life. Our end-of-life client, who we got very, very close with, who was on our program for probably about a year, which is not typical, right? So usually our end-of-lifes are usually, a month or so. But we did have this client for about a year, and we were following him for his end-of-life journey. And that's what I always refer to it as a journey, because I say you steer the ship of your journey, and we're just here along the way to help. And he shared a lot of life experiences with us. We got very close with him, and very much involved in his care. And, he always referred to, he hoped that he would come back as a butterfly. And his song at his funeral was about butterflies. If butterflies could talk, that was the name of the song. And he played that for us lots of times, and we were heavily involved in his care. So now whenever I see butterflies, of course, that's what I think about is him. And his family, are so sweet. They still keep in contact with us. So, we get highly involved with these clients, and we become more than nurses to them, right? So when you're going to a client's house, several times per week over the course of a year, you get very close with them and the family. So, you get these connections that are lasting even after the client passed. And so I will never see a butterfly ever without thinking about him. Change. Well, of course, we always need more nurses, right? Power is in numbers. So when you're limited over the number of nurses that you have, of course, you're limited of what you can do. So, to be able to have more, especially in the community area, I really feel that would make a huge difference. We're promoting care at home as much as possible. We're having more and more of our population that is aging. So, of course, we need more professionals to be able to help keep these people at home and functioning as safe and as well that they possibly can. My name is Gonish Keeping, and I am a registered nurse.